Namaste. I am Dr. Parit Ladani from New Face Maxillofacial Surgery Clinic in Andheri West, Mumbai. One of the most common doubt patient ask is, Doctor, do I need braces or do I need jaw surgery as well? It is a very important question because both braces and orthognathic surgery are powerful treatments. They solve different problems. Today I will explain the difference, who needs what, and how we decide right approach. Start with braces. Orthodontic braces are designed to move teeth into right position. They are excellent for crowded teeth, gaps between teeth, mild bite issues like overbite or underbite, improving smile alignment. For many children and teenagers, braces alone works perfectly. They align teeth and give straight smile. But here is the limitation. Braces only move the teeth, not the jaws. When braces are not enough, if the jaw bones themselves are misaligned, braces alone cannot fix the problem. Let me give you some examples. If your lower jaw is too forward, underbite, braces can't pull it back. If your upper jaw is too small or too backward, braces can't move it forward. If your jaw is shifted to one side, braces can only adjust teeth, but your face will still look asymmetrical. In such cases, even after years of braces, patients still feel something is off. That is where the orthognathic surgery comes in. Now, role of orthognathic surgery. Orthognathic surgery, also called corrective jaw surgery, repositions the jaw to correct these bigger skeletal problems. It is recommended when you have severe underbite or overbite, an open bite where teeth don't meet properly, jaw asymmetry or facial imbalance, breathing problem or sleep apnea caused by surgically moving the jaws into correct places. We create a foundation where the teeth, smile and bite can function properly. In many cases, braces and surgery works together. Braces prepare the teeth before surgery. Surgery corrects the jaw. Braces are then used again for the fine tuning. This teamwork ensures that both your bite and your facial balance are corrected for long-term stability. At New Face Clinic, Andheri West, we carefully evaluate each patient with 3D scan, orthodontic input, and digital planning. Some patients need only braces while others need surgery. The key is choosing the right treatment early. If you are confused between braces and jaw surgery, book a consultation at New Face Clinic today. Together, we will find the best path to your confident smile. Thank you.